Good morning. Today we are announcing that we do have another case of COVID-19 here in British Columbia. That will be our 8th case. This is a woman in her 60s who is visiting family here. She's from Tehran, Iran, so this is another exported case from Iran. She is in the Vancouver Coastal Health Region. There's a very small number of close contacts and everybody is in isolation, so that's good. So she is in isolation at home with a relatively mild case, so we're thankful for that. The investigation is ongoing, but we don't expect to have very many contacts. She was doing the right thing and staying away from others, and certainly was assessed safely in our health system here. The good news that we have is that our first 4 cases have now all fully recovered and are released from isolation and doing well, so that's very good. And our other 3 cases that we've been following are in stable condition, and all of them remain in isolation at home. And many of the contacts of those cases have been finished their 14-day quarantine period, and we have no new cases and nobody with symptoms from those cases. So that's also very good news. I think this tells us that this is a rapidly evolving situation. We're watching it globally, and as we know, there are many more countries now who have more cases. The situation in Iran is one that's very concerning. We certainly are watching that carefully. And we know that we have a large Persian community here in Canada and here in BC that are also watching that very carefully. The situation in Italy as well continues to evolve. Here in BC, we are still very much in our contain phase, and we are testing. As you know, we've tested over 1,000 people in this province, and we have the 8 positive cases so far. We continue to be in this phase of being highly vigilant, watching carefully, making sure that people who are sick, who have traveled at all, are tested and isolated, and we continue to ask people to do that. We know that this is changing around the world globally, so we want everybody to take the actions that we need to keep our communities and our families safe. And even if you haven't traveled, if you're sick, please stay away from others. Keep it to yourself. Do all those things that we need to do at this time of the year to prevent transmission of infections, and that's cleaning our hands regularly, covering our mouth when we cough, not touching our face and eyes, and staying away from others and staying home if you're sick.
Today out of Washington State, the first death that has been announced happening very close to our borders, and they are going to be announcing more cases. How closely are you working with our neighbors to the south with land border?
Yeah, so we are obviously in contact with our colleagues across the United States, but particularly in the Pacific Northwest. So we're watching very carefully what's happening there. Nationally, we also have people from the Public Health Agency who are working with the US CDC. So we're very closely connected to what's happening in the United States, and we're supporting each other. We've been lucky in many ways that the people that we've had in Canada and here in BC who've had this illness have been relatively healthy and have had a relatively mild illness. So we're thankful that we've not had deaths. But it's the same message, whether it's the land border or people who are coming in via plane. We want everybody to be really aware right now of respiratory symptoms. And if you're sick, to please isolate, stay away from others, get the help that you need. You can call 811, you can talk to your local public health office, but we can help you get safely assessed and treated if need be. But the message is the same. We all need to do our part right now to try and prevent transmission of infection.